having a sore throat, and it was persistent. And I went to see my general practitioner, and they prescribed some antibiotics to me. I happen to have a heart condition. I have a pacemaker defibrillator in me, and as a part of my routine examinations, they were doing x-rays on me. Then they saw something in my throat, which was not right. They referred me to an ear, nose, and throat specialist in the Prescott area. That led to a biopsy and led to the diagnosis of cancer. By the time they did the biopsy on me, it had already progressed to stage 4.
I think any patient, once they hear the word cancer, is faced with existential threat to their survival. And I really encouraged him to, seek the input of our entire team. So members from our multidisciplinary team who specialize in treating this cancer was really the outcome of that first appointment.
I asked them I asked them direct questions. Have you seen this type of cancer before? Have you dealt with throat cancers? Dr. Shellenberger said, Armand, this is what we do. You cannot believe the care and the effort that everybody here put into your treatment and made you feel like you had allies and a friend in what was going to be a tremendous battle, quite honestly.
Attitude is huge here in managing cancer patients. So our approaches, really depend a lot on the things that we can't measure, the things that are not reflective of in x-rays or tests or lab values. Cancer oftentimes brings out the best in people, that when they're fighting such an enemy, they can conjure up the fight against this enemy with, more drive than even they thought they knew they had.
When I had to get a mask made for my throat treatment, that required me having my head and face bolted to a table to obtain the best possible result. And I did not want to go through that. And I came up off the table 3 times because the feeling of being bolted to the table was overwhelming. And the nurse on duty said, Mr. Merrill, you have to do this. There's no alternative. And she just gave me that confidence and the knowledge that I was going to be able to do it. And we got through it.
It was our goal from the beginning to be cancer-free at that 2 to 3 month period after the end of treatment. And so when we have confirmation of that by our imaging studies, it's a moment to celebrate, and that's what we enforce to our patients, that this is what we set out for, this is what we accomplished, and we have every reason to be optimistic about the future and consider this battle well fought.
I think my wife cried, and we were just overcome, and he said, it's just gone, completely gone. These people here, through their knowledge, through their compassion, through their experience, they come in here every day and they fight this thing that's descended on us. They fight it. What a team they have. What an effort they put through. These people are remarkable. And I feel that, and I'm so grateful for what's happened here. So that if you have to do this, Banner, MD Anderson is the place to go to. I have no reservation about that at all.